Hi, how are
Hi.
you?
Hello, Dr. Ruhi. I'm doing well. How are you?
Very well.
Okay, so shall we start?
Yes, absolutely, we can.
Okay. So, hello everyone. I am Samriti. I belong to Girls First. And today we have Dr. Ruhi Satija. She is a renowned psychiatrist and psychotherapist with expertise in women's mental health, addiction medicine, OCD, anxiety, stress management, and behavioral disorders. She currently runs her own clinic, Divine Mind Clinic in Mumbai. As you all know, during this special International Women's Day celebration, we are following the theme of Break the Bias. And Dr. Ruhi has been really very kind to give us the time to bust some myths and biases related to mental health. So first and foremost, Dr. Ruhi, thank you so much for your time today. And that was a very short introduction at our end. So please tell us something about yourself. You would like our audience to know.
Sure, sure. Thank you for your kind introduction. So basically, you said half of it. I'm a psychiatrist and I'm a psychotherapist. I'm based in Mumbai and I'm associated with two more hospitals along with my own clinic, that is Divine Mind Clinic. I do take online consultations and therapy sessions as well. And I'm a new mom. So that is exciting. So now I'm myself understanding, the dynamics of work-life balance. So that is why, like you said, giving time and having a fixed time when you know that the baby is not going to intervene is little difficult. But as women, I think we all know that this is the most important aspect of life. And the questions, I think some of the ones that you have talked about are similar. So I'm quite excited about this.
Dr. Ruhi, hearty congratulations for having a baby.
Thank
And I
you.
really hope you must have been managing it all by yourself and you would have been doing amazing. Uh,
Thank you.
so,
Thank you
here's
so
to that.
much.
Yeah. So, Dr. Ruhi, very basic but an important questions I would like to understand from you. That
Yeah.
is, what is the basic difference between psychiatrist, psychotherapist, and psychologist?
All right. Okay. So you need to understand, first of all, I'll differentiate a psychiatrist and a psychotherapist and psychologist. A psychiatrist is a doctor. Okay, somebody who has done MBBS in allopathy, that is like the foreign medicine or English medicine that they call. We do MBBS first, and then we go for post graduation, which is either in form of DPM, either in form of MD or DNB. It can be anything. Basically, the post graduation in psychiatry. So what a doctor does is their job is to diagnose the illness, give medications, one thing. Second is of course therapy. Okay, so it's a misconception that psychiatrists only give medicine. I am a psychiatrist. I only don't give medicines. I do a lot of therapy sessions. So it is a misconception. However, not every psychiatrist is trained to give sessions. So for doing therapy, we need to have specialized training in, for example, CBT, REBT, whatever technique we feel that we are comfortable with, we get trained in that, and that way we can prescribe medicine along with taking the sessions. Okay,
Okay.
sessions means counseling session, which is basically a 45-minute talking session where a person sits in front of you, tells you what you're feeling or what are the issues that you're facing, and we try to come up with some practical solutions. All right. Now, psychologists and psychotherapists are basically either BA, MA, or BSc, MSc in psychology. All right. So they are not from the medical field. They cannot prescribe medicine. They can only do counseling. Right. So general term counseling is a psychologist. It can be in a form of, career counselor. It can be in a form of corporate counselor, etc., etc., child counselor. A psychotherapist is further trained in psychotherapies. For example, some particular technique of doing counseling which is specific to some illnesses. For example, if CBT is there, that is cognitive behavioral therapy, that's a different type of therapy. In psychotherapy, what we do is we do not just take care of the current problem. We also take care of, what were the childhood issues, and we try to find out what are the reasons that the person is facing issues today. What is it in their childhood, experiences, workplace? We try to dig a little deeper on who the person is, why they are this way, what are the patterns in them. So psychotherapy, if you talk about the core, is is a very long-term process. It can go till years. I think that is why people have a misconception that counseling, if one started, that will go on for years. That's absolutely not true. For example, if CBT is there, hardly 8 to 12 sessions is what we talk about to get some substantial difference, right? So that is just 2 to 3 months of therapy if you have one particular issue. But then again, because it is a mental health problem, every person is different, their needs are different. So the number of sessions depend on them. But psychotherapy, yes, continues for long. CBT is not a long-term procedure. Okay, so this is the difference between a psychologist and a psychotherapist. If I have to explain it in a nutshell, psychotherapists are specialized psychologists who have further taken training in psychotherapy.
Oh, okay. This is really wholesome information about the differentiation. And it is very basic about people who have of misconception about these three things. Even if they have a problem, they face any kind of problem, they don't know where to go and whom to approach. This is really helpful.
With you.
Yeah. So many times a child goes silent and stays away from their parents and often hides various kind of things he or she is facing. So what would you suggest to those parents to deal with such kind of things? Yeah.
Okay. I'll divide this answer into two parts. Okay. One is very young children, like for example, 5, 6, 7, 8 years of age. And then I'll talk about the teenagers because both come in the category of children, but the approach has to be very different. All right. Yeah. So when you're talking about younger kids, it might sound very rude also to some parents, but I always start with the parent. Okay. See, a 5, 6-year-old, 7, 8-year-old child, if they are hiding something from you, the important part is not that they are hiding. The important part is why they are doing that. Why is it that they are not trusting the parent enough? Whether they are fearing punishment, whether they are fearing some other type of, response from the parent, which is of course not desirable. That is why they are hiding. Because of course, that age of children, they cannot be manipulative and they cannot, plan so much. If I don't tell them something or the other might come.
They don't have that kind of vocabulary to reach out to you and they have certain fears.
Exactly. So first thing that you need to understand for these parents is that instead of focusing on why they are hiding something and what they are hiding, first focus on trust building, right? Be there for your child. Give him time to come to you and tell them that, this space is open. We are not going to judge you. We are not going to, first of all, take out that fear that we are going to scold you or, beat you for some reason. First, take out that fear so that the child feels comfortable. Second is not pushing. Okay, because if we are after them and we are just on their head that tell me what did you do, blah blah blah, it will only worsen the situation. Okay, so we need to understand that in this age it's more important to focus on the parental behavior, that what is the behavior in the parent that is making the child so scared of talking about this. Okay, whereas when we are talking about teenage, okay, now in teenage, of course, parental issues definitely can be there. And, even when they grow up, parents' perception also change that, they now try to be a bit more strict sometimes or too friendly. Both of them can be, difficult. But then again, we need to understand that teenage itself is a very confusing age. Okay. The worst thing that I see is that from teenage, we expect the maturity of an adult. That's just not possible. The prefrontal cortex, which is basically the thinking part of the brain, doesn't even form till the age of 21 to 22. So I don't understand how do we expect our teenagers to make some rational decisions, right? We see, in my OPD, patients will come and they will tell me, yeah, if he's 13-year-old or 14, his board exams are coming, he's not seeing his future. He cannot see his future because that part of the brain is just not ready. Right? So we need to understand that first of all, see again in yourself that what is it in you that is bringing out this behavior? Why is the child resistant to talk? Then again, of course, in teenage, there can be issues that the, child doesn't feel comfortable in talking. It could be, some relationship issues. It could be some addictions. It could be bullying going on. So many things are there. And then we have so many, body image changes going on. A physicality is changing. That can bring a lot of apprehensions. So just try to find out, especially when you need to be attentive is if the behavior changes suddenly. If it is a subtle change, it could be more of the natural personality change in the child. But if it is a sudden change, that definitely should be an alarming situation, and you need to figure out that what is it that's going on with the baby or the child. So you need to be very aware that these are real issues. Okay, don't think that your child is good and he's well behaved, so he cannot be into drugs, because there is something called as peer pressure. We see in schools that the cutest of the child gets trapped into that, because sometimes they are seeking validation, sometimes they are seeking friendship, and then they get stuck. So we need to be very, very careful in this. Again, what I would suggest is, don't force, give them that space, tell them that you are there. Especially in teenagers, if you feel that it is difficult and the relationship somehow is not working, please take help of a professional. Why? Because the damage done at that age lasts very long.
Right.
If the child loses trust in the parent, right,
Yes.
he will never be able to trust the parent. That's one thing. Second thing is, he will not be able to trust anybody for that matter, because this is the age where our core beliefs or the patterns are being formed in how we see ourselves and how we see the world. So if at a very young age they get this betrayal sort of a feeling, or they feel that I'm not safe at home, I cannot be free at home, I cannot be myself, that is a pattern that they will carry in their adulthood as well, which will of course disrupt their life as well as the people they will be involved with. So it's very important that you are very sensitive and careful. And again, I would suggest that children are children, let them be kids, right? Don't expect them to act like a 30-year-old taking the right decisions and making the right calls all the time. Age hai, they're going to make mistakes. Be there for them so that they can learn from it, instead of judging them and criticizing them for it.
Right.
I think that
Yeah.
would be a good approach.
Yes. Dr. Ruhi, I have heard people, the new parents nowadays, they are more concerned about age-appropriate languages. Do you think it
Yeah.
will really help the children?
Definitely it does. Okay, so what that does is, see, it will be very difficult for me to use a language that the teenagers might be using right now with my child. But you need to understand, sometimes you have to put up this show. Okay,
Yeah.
why? Because then they will be comfortable. You might be uncomfortable, but you are mature enough to understand that this is temporary and you don't need to take it personally. When you do that, it's very easy for the child to open up. So for example, I don't play video games. I have never played video games. I don't even understand doing that laptop thing. But because I have so many patients who are children, I keep myself updated with what are these new games coming in the market, what are the latest trends. Somehow from Instagram we get to know that these are the reels that are going on. So
Yes.
when the patient comes to me, and especially in children, it happens that parents bring them and they don't want to talk about it. So I just don't talk about the illness with them. I just start with this, that how is school, how is friends, any relationships. I talk about the games that they are playing, some movie that has come up. So what
Yes.
that does is, they see that, okay, she is not like the normal adults that I've seen in my life. Okay, maybe I can talk to her. So initially we focus on rapport building, right? They need to first trust me to be able to see. They are going to tell me the most vulnerable things that they are not comfortable sharing with anybody. They will only do that if they trust me, right?
Yes.
So I'll do whatever it takes to do that. So changing the language is definitely one of the easiest way, to be honest, more than
Yes.
anything else, to do it, right? So I know those slang words can be very difficult also sometimes. Sometimes you feel that, okay, what am I doing? But you need to understand that when you are the idea is to see the bigger picture. If the child gets to trust you, I think it's a price well paid.
Yes. Absolutely.
Yeah.
Absolutely. And also, this process of trust building comes very first throughout the process. And
Yeah.
I think that is only the foundation to gain that kind of confidence inside that person who is going to share a lot of things with you.
Yeah.
So,
Yeah.
yeah, that is the very generic thing to be followed. And,
True.
um,
But
and
it
this,
doesn't get followed a lot. That's the problem.
sorry?
But it doesn't get followed a lot. That is the problem with the society, isn't
Yeah.
it? Not just with
And
the
also,
professional. I think
yeah,
everybody should be doing that. You need to
yeah,
think that if somebody is coming and sharing their pain with you, that is the utmost respect that they can give you. What is the biggest honor in your life, that somebody will come and tell you that, I'm suffering and you help me? So we need to
right,
respect that. And I feel that it takes huge courage. For somebody to come and talk to you, I can never do that. I know when in psychiatry, like it's mandatory to go through therapy yourself so that you understand. I remember that when I had to sit with some of my colleagues and share something of mine, to be honest, I never shared the deepest secrets till now. Right. So, but I respect it that people do come and do that with me. So I know how it feels at that time. So the only thing that I can do well with them is give them that space where they can trust me, give them, that honesty that it's okay to be yourself in front of me. And it takes time to do that, but I think that time is worth invested because otherwise, what's the point of therapy?
Right, right. Totally correct.
Yeah.
Like people are nowadays looking for people who would allow them to totally be themselves, like
Right.
lose out, open up, and everything.
Yeah.
You were right when you said that we need people every now and then, not only going to a specialized doctor or someone who is very confined and know about those things only. But even in
True.
our family also, we need people like that and friends,
Yes.
colleagues. Yeah, absolutely. Yeah.
Absolutely.
So, doctor, it is it's this year when most of the kids are having exams right now. So, any of the tips for the parents as well as the students, like how to keep a calm and create a stress-free environment for them during the
Right.
board exams, especially. Do you
Right.
have any advice for them? Yeah.
Absolutely. So at this point of time, the student, category of patients increases a lot because everybody is stressed. To the parents, my first suggestion is don't think about results. To the children, my first suggestion is don't think about what your parents are thinking. As simple as that.
Right.
Then the stress is out. See, the stress is not about the exam. It's never about the exam. It is about what is going to come out of it. Okay?
Yeah.
Parents have expectations. Parents have instilled these expectations in children. Then the children expects from themselves and it's all chaos. An exam is just an exam. Yes, we need it. Yes, we need the score to do well. But that is in no way a definition of who you are as a person and in no way a definition of how your life is going to be.
Right.
Very honestly
Yeah.
telling you. If you see my score, even my school students even till now don't believe how I became a doctor. So don't worry about it. Okay. Although, if we talk about the Indian education system, we can literally have a 3 hour chat and I have so many opinions on
Right.
it, but we won't go there because we have that restriction of time. But again,
Yeah.
whoever is giving, focus on what you can do and not what you cannot do anymore because there is less time. Second
Yeah.
thing is focus on revisions, right? So that 1-7-30 rule, I'm hoping everyone knows. So what that is that whatever you have read today, revise it before sleeping, then on the 7th day and then on the 30th day. That way you
Oh,
will not forget. Yeah, so that's a wonderful technique. Okay, to apply. And of course, the easiest way is that instead of just cramming, try to explain it to somebody. That way,
okay.
what will happen is when you explain it to someone, you will know how much you understood. कभी कभी क्या होता है बुक खुली हुई है we read everything and after 5 minutes we don't even know the topic क्या था, right?
Yeah.
So when you're explaining it to somebody, you will also notice that this is something that I haven't understood, so you can go back. Another thing, don't just rely on this. All right, somebody messaged something. Okay, how sweet. All right. So the next thing that they can do is don't rely on the books alone because that can get very boring. Sometimes the easiest way to do your complete your subject is to, I'll give you the secret that I use throughout my education is one is of course YouTube, right? You listen to the
Yeah.
topic. The second is just go on Google Images. Okay, this is very, just do this. Try it today. Everybody who wants to learn about any topic, just write the topic name. Don't go for web page or articles on it. Go on Google Images. There will definitely be somebody street smart who has made a short note of that topic. पहले उसको पढ़ लो.
Right.
Right? So at least if 5 mark question is there, 3 marks you already got from that one sheet. ठीक है?
Yeah.
बाकी दो के लिए जोन सी बुक पढ़नी है पढ़ते रहो. Don't worry. At least
Yeah.
the anxious part is over. So Google Images saved me and then YouTube saved me. So just try to incorporate that and that will make the studies interesting, faster. Smart work always works. I do not believe in hard work. I'm a very lazy person, so smart work helps me. So YouTube and Google Images were my two savior. So try that.
Now, actually, Dr. Ruhi, your words will be a savior for many of the viewers who are writers right
I'm glad
now.
we
Yeah.
should help, no?
Even
In any
I
way.
imagine
That's what psychiatry is not just about treating depression.
I,
This is all the things that we do. So we need to take advantage of that, na?
yeah. And
Yeah.
guys in the stressful situation, we're actually not looking for the people to come and rather than listening, they are going on lecturing or get tips and
Yeah.
tricks. We don't need them. We just need someone to listen and give these kind of facts which
Yeah.
can actually help us. So
Yeah.
yeah, I mean,
And
yeah,
another thing, if you feel that you forget a lot about it, one more thing that works is record your own voice and then listen to it.
yes,
That's
that,
another very good
yeah,
way of reviving. So you just
yeah.
record your own voice and put on speakers when you're taking a break. Let it, speak in your ear. अपनी आवाज याद रहती है, टीचर की नहीं रहती है. So this also helps.
The information you are sharing, I wish to note it down and follow those things myself.
Sure, do that. I think the video will stay on your profile, so you
Yes,
can
yes,
use it. No problem.
yes,
Yeah,
definitely.
I know, I can understand.
Yeah. So,
Sure.
doctor, people often mistake that approaching a psychiatrist is only needed in case of mental illness. Please
Yeah.
help us to understand that and break the bias.
Right. So see, you need to understand that only half of the patients that I get come for a mental health disorder. ठीक है.
Okay.
Rest of them maybe are stuck in their life. They're not able to make some decision. Sometimes they had some breakup. They're not able to get over it. Sometimes they're in the middle of changing careers where they're not able to decide the direction that they want to go to. Sometimes everything is going great. I still have, like, I don't call them patients, they are my clients, so they just come for self growth. Okay. For example, you're somebody who is very emotional, and then you feel people take advantage of you, so you work on your emotions. Sometimes you overthink, you come for that. Sometimes you have sleep issues, you come for that. So it is not at all true that you only need to see a psychiatrist when you have a mental health disorder. You need to come to a psychiatrist as soon as you feel that in your life either you're stuck somewhere or you're not progressing the way that you want, simply put. ठीक है.
Yeah.
अभी क्या हुआ, because psychiatrists are overfilled and we have this bias, these so many life coaches and everything came in between. They are like, the middlemen who got some training in career, some training in business, and they give coaching. But a psychiatrist knows everything, na? So why won't you go to that? But you don't go because you don't know you can go them for that.
Right,
Right?
right.
So that is the first misconception. Second, why they don't come is because they feel that psychiatrist so medicine dega. Right, that is another misconception. In fact, if I have to see the percentage, I think maybe 40, 50, 60, out of the ones who come for a disorder, I'm not talking about the clients who actually walk in with a disorder. It's not necessary that they will get a medicine. There are
Okay.
scales, there are criteria when we need to start medicine. That's when we do. So bottom line, if you are not okay, or if you feel that your life is not going the way that you want, go to a mental health professional. That's it.
Right. Absolutely. And doctor, like, if someone is feeling not okay, but he or she wants to take time for that because he or she somehow knows that yes, this will pass on and I'll get over it. And let's not go and see a doctor. Let's see
Right.
ourselves for a few days. So is it okay to be like that?
Is okay with you, then great.
Yeah.
It is possible that after a few days you yourself will find a solution. No
Right.
problem. But when you can already see that you have wasted 3 months of your life, stuck at a point, what is the need?
Right.
Think about it. Like, you go for 2 hours to a therapist, they help you practically solve a problem. Why do you want to suffer for 3 months?
Right.
That's
Right.
it. We cannot
Yes.
force anyone. Of course, it's a personal choice. You will only come when you are convinced, right? The only thing from my side would be, don't suffer. Life is too short, right? What's the point? 3 months, 4 months, you're stuck on a point whether to take that job or not, whether to take that course or not, whether to take that guy or not. 4 months of your life, उतने में तो तीन चीजें और चेंज हो जाती ना. So don't do that to yourself. Don't suffer. Just get over it. See, even if it's the purest form of water, if it stays at a point, it becomes toxic.
Right.
You're a human being and you're 70% water.
Right, right.
So don't stay stuck at a point. Just find a solution. Even if it is not a very good solution, just find something, take the next step. बाकी रास्ता बन जाता है. So if you are able to do it on your own, great. You think I want to give it another week, 1 month, 1 year, perfect. It's your life. Decision has to be yours. But if you are anyways going to do it 1 year later, why not do it now? You will save a
Right.
lot of your time, isn't
Yeah.
it?
Yeah, this
That's how it's going.
session could be very much helpful to save the numerous days. Totally.
Absolutely. I get patients who will come and tell me, yeah, 6 years I'm suffering. I said, Baba, 6 years. 6 years, mein I don't even know who I was, 6 years back. But then 2 महीने में they ठीक हो जाते हैं. So it doesn't make me feel good when they get better in 2 months. I actually feel more bad. कि यार जो चीज 2 महीने में ठीक हो सकती थी, why did you suffer for it, for 6 years?
Yeah,
Every
totally.
time a patient tells me ना कि यार कहीं ठीक नहीं हुआ, यहाँ के 2 महीने में ठीक हो गया, I actually tell them कि it's a failure of the system. That
Yeah.
somebody who suffered for 6 years only needed to suffer for maybe 2 months,
Yes.
isn't it? But that's not that's not a very ideal situation. I don't feel good when they come and tell me that from years I was not okay and you made me better in 6 months. I feel bad. Yeah, why did he suffer for those 6 years? 6 महीने तो जो लगने थे उसका कोई कुछ नहीं कर सकता. If the
Yeah.
treatment requires 6 months, it requires 6 months. I cannot do anything about it. But what about the 6 years that you lost? It's your life. And that too prime years. These are young children that we are talking about. Years when they are shaping themselves, when they are making their careers, becoming who they are. उस time पे if they have suffered, not worth it at all. क्या होगा?
Yeah.
साइकाट्रिस्ट के पास चले जाओ, नहीं पसंद आएगा, दूसरे के पास चले जाओ, 4 के पास चले जाओ. I tell them that's okay. It's not necessary you come to me. But if you want to go to anybody, go to a trained professional. That's
Right.
it. 4 चेंज करो, 5वें के पास रुको. But see, if I have a problem with banking, I'm not going to go to a restaurant for the solution, right? I'll go to a bank. So if you have
Yeah.
a mental health disorder, go to a mental health professional. Now, why do you go to these babas and then your relatives who have no, knowledge about, but they have all the opinions.
Yeah.
हर एक पूरे इंडिया में हर एक के पास डिप्रेशन का इलाज है. सिर्फ
Okay.
प्रॉब्लम ये है कि ठीक होता कोई नहीं. This is
Yeah.
the reality. So why are you suffering? That is my
That's
point.
with someone that needs to be done right away. Otherwise, we will be trying on, but we'll be stuck there only.
Yeah.
Yeah.
And then it takes even longer to treat them also, na? It's
Right.
not just the problem that you came late. You came late, you came in a worse form, so the treatment also will be longer.
Yeah. It
So
will
what's
also
the
take.
point?
Yeah. Yeah.
Take an opinion. I'm not saying that अभी डॉक्टर ने बोल दिया तो दवाई शुरू हो ही जाएगी. आप बाहर आके नहीं भी लोगे, so he's not going to come to your home to check ना कि आपने लिया नहीं ली. Go and take a consultation. Listen कि भाई वो क्या बोल रहा है. एक का पसंद नहीं आया, 2 का opinion लो. Then decide what works for you.
Right.
But before listening to a professional who actually has knowledge, how can you decide what is right?
True. Yeah.
Yeah. Yeah.
Yes. So, Dr. Ruhi, if people are facing with depression, like, is there any chance they might suffer from any physical illness?
Yes. Yes. So these are called psychosomatic illnesses. That's a separate entity in psychiatry. First of all, it is very possible that the depression is being caused with something physical. For
Okay.
example, somebody who has thyroid issues, somebody who has PCOS, they have higher chances of getting depression because these are all hormonal imbalances. It is very possible that your physical illness has caused the depression. For example, cancer patients often have simultaneous depression going on. In infertility, we see that a lot of patients get depression. That's one part. Second is definitely if you have depression, your chances of getting migraine increases, your chances of getting anxiety increases. If anxiety is there, your chances of increasing, blood pressure increases, diabetes. In fact, depression is related with a lot of physical illnesses. So that's very possible. The common one that happens is headache, fatigue, then you have insomnia, sleep issues. These are very commonly associated with depression. And indigestion, the food doesn't get digested, weight gain, sometimes weight loss. So these are all physical symptoms of depression. Sometimes the patient, for example, in high functioning depression, the person doesn't even realize that they are
Okay.
depressed. So they have all these physical symptoms. For example, in Indian females, the most common sign of depression is back pain. They'll have these random back pain. 7 दिन back pain होता रहता है, 7 दिन सिर दर्द होता रहता है. They might be, they might have mild depression.
True. Yeah.
Yeah.
Yeah. So, as a psychiatrist, what are the key things that you want to tell to our audience?
Okay. The first thing is, don't be scared of psychiatrists. They are very cute. I'm sitting in front of you. Second is, it's not necessary that you will come to my clinic and I'll fit a medicine in your mouth. Not at all. We are only going to talk and we are going to discuss the options that are available for you. And third thing is, if you are feeling कि अगर आप psychiatrist के पास आओगे तो आपको कोई पागल बोलेगा, कोई कुछ और बोलेगा, don't worry. Even psychiatrists are called pagal doctor. So we are also suffering. Now we can suffer together. Right? What I always say is that stigma is there. I understand, right? But you cannot continue suffering just because people are not understanding.
Right.
It's your life, right? And second thing is, if you are still uncomfortable in walking into a clinic कि कोई देख लेगा या किसी को पता लगेगा, online consultations, no one needs to know. Right now, all the psychiatrists are available online. Even therapy sessions, I don't even do it in my clinic. I only do online. So everything is available at the tip of your finger. अगर आप आधे घंटे अंदर जाके किसी से बात कर रहे हो, nobody needs to know that you are under a mental health treatment right now. Just go for an online consultation, get treated. That's it. And if it's about medicine के मैं अपनी pharmacy में जाऊंगा घर के पास वाली उसे पता लगेगा psychiatric medicine है 1mg.com, it delivers at home. Nobody needs to know क्या आया package में. Right? So that is what I would tell you, that the only thing important is that you are happy in life. Don't let anything, any judgment, anybody's opinion come in between of your pathway to be happy. If you are suffering, get better at the cost of losing those people. It's okay. They are not going to come and cry with you. They are not going to give you a shoulder. They are not going to solve your life problem. They are just there to judge you. Let them. It's okay. वो anyways कुछ अच्छा नहीं बोल रहे तो इसके बाद भी नहीं बोलेंगे तो क्या फर्क है? At least you will be fine ना.
Yes.
Right?
Yeah. Yes. So, are there any key differences between how men and women deal with depression, anxiety, and stress? Like, are there any related to these differences that you would like to break?
Yeah. So definitely there are a lot of differences in the way these two approach. Okay, I will take for like every illness has different spectrum, so I cannot talk about all of them. Let's take depression because that is the commonest, right? So for example, if a female gets depressed, she is more on the verge of sadness. She's more on the verge of self-pity, criticizing herself, that sulking, feeling guilty about things, feeling that I was not good enough, blah blah blah. She mostly takes it out on herself, probably because she was never allowed to take it out on anybody else. Okay, for males, always had the liberty to take it out on others, so that is what they do. Most, I'm not saying all of them, of course it can be other way also, but men tend to have more aggressive tendencies. Okay, so they will not feel sad and cry that much compared to female. They will be more angry, aggressive, hostile, right? Instead of blaming themselves, they will blame others कि तुम्हारी वजह से हुआ है, you are the reason I'm in this situation. Then there are more chances of getting addicted to alcohol and different substances to feel better in males.
Yeah.
Females will not, they will mostly take sleeping pills, whereas males, what they do is they will not go to a psychiatrist. एक पैग लगा लेता हूँ तो मैं ठीक हो जाता हूँ, सुना है ना, हर घर में एक ऐसा होता है. तो जो एक पैग लगा के ठीक हो रहा है, my question is वो ठीक किस चीज का हो रहा है? There is something wrong ना, जो वो एक पैग से ठीक कर रहा है. This is called self-medication. So they are depressed or anxious, and once they take alcohol, they feel better. It works. Alcohol gives them the good feeling that they need on that day. The problem is it is not curing your depression in any way. Second, it is making you addicted. Then you start having sleep issues कि अब मैं जब तक नहीं पीता मुझे नींद नहीं आती है. Then you need it even more कि जब तक मैं नहीं पीता मुझसे मीटिंग में नहीं बैठा जाता है. So these are some of the differences that we see in males versus females. And of course, the guilt is more in females, whereas in males, it is more of blaming nature.
Yeah. So, doctor, I want to ask you this question that among your clients, what is the percentage, like roughly, male and female?
Oh, equal.
Oh.
It also depends on seasons, yeah. So like I said that, for example, New Year's is coming, Valentine's Day is coming, it changes. But then I have literally patients from 7-8-year-old to right now the patient that I have is 75-year-old. I have males, I have females. I see a lot of patients. Yeah. So all genre, all age, all gender. I have a lot of LGBTQ positive people as well. So it's not just males and females that I'm seeing. I see humans. So I have all of them.
This is really nice. You are helping out so many people just to ease out what they are feeling, and they're just, constricted and confined to a particular thing, or very much controlled to behave in a certain way. That is our society, and yes, definitely we need people like you everywhere to just understand. And yeah, and yeah, this is the thing we currently need. Today's generation is someone just to listen so that they will feel good. Yeah.
True.
And women tend to ignore many signs of not just mental health, but overly they tend to ignore. So, would you give us some examples of signs that a women usually ignore, but could be linked to a serious condition, and
Yeah.
they should seek help for that?
Right. I'll talk about the severe ones later. I'll talk about a very simple one that is there in almost every home. They don't
Yeah.
feel good. They are stuck in marriages, but they don't know it's depression. Okay. They will keep on blaming your husband is like this or the family is like this. That's why I'm stuck. I agree with it. But the thing is, now you are married in this home and you are planning on staying. You are planning on, not divorcing the person. So is this even practical? Okay, for the next 50 years, you have to continue suffering.
Hmm.
The commonest thing that they ignore is that they do not feel happy,
Yeah.
right? That's also a sign. It does not need to be clinical depression, but you're not
Mhm.
happy, na? So what are you doing? What's the point of being alive, right? But of course, then when we have to talk about clinical signs of depression, sleep issues, random aches and pains, headache, पता नहीं क्यों हो रहा है, backache, पता नहीं क्यों हो रहा है. These are very common signs. Then you have, भूख नहीं लग रही है, ज़्यादा लग रही है, appetite changes. Then you have weight gain, sudden weight gain. In 2-3 months, you are gaining 10 kgs. That could be
Yeah.
related with mental health. Anxiety is something that is very commonly ignored. That is, you're feeling fearful, restless all the time, on the edge. You feel like crying. You feel like, something will go wrong. This feeling of something will go wrong sometimes is taken as, she's very caring. It's nothing related to being caring. It is just about being anxious. So these are very subtle signs that people, forget that it can be a mental health issue. But yeah, these are the common ones that people don't come with. But then when it becomes severe, they come. But then it starts like this. So I know that these are the things that they ignored at that time. कि हो जाएगा manage.
Yeah. Right.
Hmm?
So, overally, to sum up what you said throughout this session, that happiness is the most important thing that we should seek for and live
It
for.
is the
Like,
only important thing that we need to seek. And to be honest, do not just seek happiness. If you're not finding it, just create it. That is what
right.
a therapist is for, isn't it?
Music. Yes.
If we are seeking, we don't know when we'll get it. If we are creating, it's just here.
Yeah. So that should be the motto of today's generation, and all the people who are suffering from I don't know even like from how many months, years, or days, they should go for help and should talk it out, like without feeling that people are judging them or the society is not allowing them to be themselves. Yes, so this is the right time to do it after listening to you. This is very motivational and very inspiring, Dr. Ruhi, to have a session with you. Thank you for that. And we will be taking some questions now. People are going crazy. Yeah.
Yeah,
Uh,
somebody has asked, how can mental health affect my sleep? Shall I take
okay.
this question? Okay,
Yes.
so mental health issues, a lot of them are associated with sleep disorders. For example, in depression, we see two types of sleep disorder. First is you will not be able to sleep, like you will, till midnight, you're not getting sleep. Second is that although you sleep on time, you wake up in the middle of the night. Okay, so this is something very commonly seen with depression. In anxiety, what will happen is you will overthink. You'll keep on thinking and you are not able to sleep because the mind just doesn't shut up, right? So
Yes.
that is one of the signs of anxiety related to sleep. Then you will not get sleep, right? Then of course there is a whole spectrum. Bipolar disorders are there, psychosis, which is like severe mental issues where of course the sleep gets disturbed. What I will point it out is that sleep itself being a problem is very rare. There's always a reason why you're not getting sleep. Sort that out, the sleep will come. Okay, so whenever somebody comes with insomnia to me, I don't focus on you're not sleeping. Okay, I understood. Why are you not sleeping? What is it that is happening in your life that you're not getting? Sleep will come when you're restful in the head. So find that peace.
Correct.
The sleep will come.
Yeah. Another one is someone is asking, how do we realize we are in depression?
Okay, wonderful question. So some of the symptoms that you see in depression, how we diagnose depression is, for example, somebody comes and tells us that they have been feeling sad. That's the first thing. But that's the first symptom. What happens is people misjudge it that if I'm sad, that means I'm depressed. Doesn't work that way. There is a combination of symptoms that have to be there to be able to diagnose it as depression. The first is that for some time you are feeling very sad, you feel like crying, you don't even know why you are crying, but that overwhelming feeling comes, you get teary eyed, you become very sensitive, small things have started hurting you, you're having sleep disorders, you're having anhedonia, which means that the things that you used to enjoy earlier, now you don't enjoy them anymore. So that is one classic sign of depression. Then the feeling of guilt, feeling of hopelessness, that there's nothing left in life, it's never going to get better, a lot of helplessness, that I'm stuck, I'm not able to come out of it. These are some of the mental patterns that we see in depression. Appetite changes, weight loss, weight gain, it can be both depending on each patient. So these are some of the signs that we see. We need few of them to be able to diagnose depression. It's not that if you're just sad it is depression, then we only go for counseling. This is another misconception that people have, that if I have sadness that means I'll get medicines. No, you will not. You will only get, because this is just mild depression, then you will only have to go for therapy. If it is severe, that's when we start medication.
Yeah, okay. Thank you for that, doctor. Another question we have, that is, what is a DNB psychiatrist?
DNB psychiatrist. Yeah. So like I said, after MBBS, all psychiatrists will have either three of these degrees. One is DPM, one is MD, one is DNB. They all read the same books. They all give the same exam. The difference is DPM is 2-degree course, 2-year course where they read the books and give exam. For an MD, the one extra year is because they have to create a thesis. So that time is for that. The DNB is also 3 years because apart from what DPM person is doing, they are also doing the same. Plus, they have to work in a hospital simultaneously. That is the format of the degree. So, books are same, curriculum is same, training is same. It's just that what extra they are doing. And MD is more into academics. So, the people who want to become professors later, teachers later, they go for MD. They are more into research aspect of it. Whereas a DNB is somebody who has worked in hospital for another extra year. This is the difference. But they are all psychiatrists. Only difference is some people claim that they are neuropsychiatrists. What that means is that apart from mental health disorder, they also take care of some neurological disorder, for example, epilepsy or some other simple neurodegenerative disorders, which a neurologist also sees, but they are also trained to do it to some extent. That is the difference. Otherwise, DNB, DPM, MD labels are different. Training and work profile is absolutely same.
Okay. Yeah. So, yes, I really hope these answers and the amazing way you explain giving examples would really help a lot of people who are asking questions and viewing you right now. Thank you, Dr. Ruhi, for joining us, and we're really humbled to have you and spend an amazing session with you. This was really enlightening, and we got to know so much facts, like how actually human body works, and we need time. That's okay to be ourselves, and yes, we should seek help whenever it is needed, without even thinking about people for whom like we are so much confined and we are not even letting ourselves breathe properly. So thank you so much, doctor, for joining us, and I hope you will join some other day to take more questions. Yeah, and viewers, please stay tuned. We will have more sessions to break such biases that we have in our society, in ourselves, and we feel stuck with these biases. Let's get over it. Thank you.
Take care. Be happy, everyone. Bye-bye.
Bye. Thank you.